an effort to address the maternal health crisis in North Carolina, I have filed the Building Understanding of Movement in Pregnancy Act, or the BUMP Act. I also want to thank my co-sponsors, Senator DeAndrea Salvador and Senator Sophia Chitlick. This act requires DHHS to provide standardized and evidence-based educational materials to pregnant patients for stillborn birth prevention. These materials must cover fetal movement tracking, warning signs requiring urgent care, stillbirth risk factors like infections, hypertension, and diabetes, and how mothers can access care, including after hours. They must be available in English and Spanish, plus other languages as needed. We will also require that DHHS develop or procure training for prenatal providers covering fetal movement education starting at 28 weeks, response protocols for decreased movement such as same-day evaluation, infection-related risks like syphilis, placental and umbilical cord risk, and all training must be available virtually and in person. The second section of the bill is focused on launching a statewide Count the Kicks campaign that we're really excited to talk about here today. Count the Kicks is an evidence-based public health initiative created by Health Birth Day, Inc., that aims to prevent stillbirth by teaching expectant mothers to monitor their baby's movements during the third trimester. Using simple methods such as a free mobile app, tracker, or paper chart, parents track how long it takes to feel a set number of movements and learn what is normal for their baby, so they can quickly recognize and report any changes that may signal distress. The program emphasizes that changes in fetal movement can be an early warning sign of complications, empowering parents to seek timely medical care, improving birth outcomes, and reducing preventable stillbirths. The goal is to educate about tracking fetal movement in the third trimester. The bill will target high-disparity areas, train providers and community organizations, and develop educational materials for expectant parents. This legislation also ensures, hey, that's why we're here. You keep things fun. This legislation ensures North Carolina families will receive clear, consistent information on warning signs and fetal movement, while also improving provider response and prioritizing communities facing the greatest risk and disparities. Stillbirth, which is the loss of a baby at 20-plus weeks of pregnancy, is an under-discussed public health crisis in the United States and in North Carolina as a whole. In fact, at least 2 babies are lost every single day here in the state of North Carolina. And our state's stillbirth rate remains higher than the national average, so that's why we're here today. North Carolina's stillbirth rate has remained largely unchanged since 2009. And we are falling behind states that have implemented comprehensive prevention efforts. Right here in North Carolina, families in Anson, Edgecombe, Sampson, Lenoir, and Vance face increased risk of stillbirth. Anson County has the highest rate. Black moms in North Carolina are 2 times more likely to experience the tragedy of stillbirth than all other groups. Research shows that women who experience stillbirth have significantly higher risk of severe maternal morbidity and mortality compared to women who experience live births. And with our large rural population here in North Carolina, second only to Texas, this is a method that will help those rural families. One study estimates that more than 15% of maternal deaths within 42 days of delivery occur in women who delivered a stillborn baby, indicating a significant association between stillbirth and maternal mortality risk. It does not have to be this way. That's why we're here. There are solutions that can save lives today. That is why we have introduced the BUMP Act and why we must make this bill a law. This is a common sense approach that strengthens care, supports parents, and saves lives. I'm grateful today to be joined by families and advocates who will share real-life examples of how programs like Count the Kicks, which build understanding of movement monitoring during pregnancy and can help improve birth outcomes for North Carolina moms and babies. Now we'll hear from those advocates as they tell their stories. First, we have Anna.
Thank you for shining a light on this neglected public health crisis. My name is Anna Lepe Vick, and I'm a mother of 3. The one is always missing. My middle son, Owen. And this is my rainbow baby, Jackson. Last Sunday, I spent the day in tears, marking what is a day I never knew existed before our son died, Bereaved Mother's Day. Our hope is that by pushing for evidence-based solutions, we can make sure our mothers will get to celebrate Mother's Day with their children in their arms instead of grieving them the weekend before. Like many parents, we were told that our pregnancy was textbook perfect, but our middle child, Owen, still died. One night I was rushed to the hospital because I noticed a sudden change of movement. After an hour, without any warning, I had a crash C-section, the resuscitation failed, and our son died. We were told, sometimes healthy babies just die. No answers, no investigation. For 5 years, we searched for the cause of Owen's death. We eventually learned through placenta pathology that Owen was perfect, but he had cord abnormalities and an abnormally large placenta, risk factors that could have been identified during prenatal care. Our son should now be a thriving 10-year-old boy, handing me a Mother's Day card along with his siblings. His death was not an accident. It was a failure of our low-risk medical care. Stillbirth devastates an entire family, not just the mother, forever. Our mental health, income, quality of life, all declined the day we left the hospital without our son. Stillbirth is not rare, and in many cases it is preventable. It does not have to be this way. As the co-founder of the National Stillbirth Prevention nonprofit Push for Empowered Pregnancy, I am so proud that our state can become a leader in stillbirth prevention, making sure that warning signs are met with urgency and are not dismissed. As a Latina maternal infant health advocate, I must add that language should never be a barrier to saving a baby's life. We have material available in Spanish as well as 14 other languages, and the app is also available in the language that the parent chooses. Language should not be the barrier. Bilingual education and resources are essential to preventing stillbirth in our country and in our state. The BUMP Act ensures families and providers get the education they need to save those babies' lives. Babies like Owen, Jace, Madison, Sophie, Ruby, Helen, Addison, Ellery, Emma, and too many other North Carolina babies to name today. There is no reason pregnancy should end in tragedy. To our legislators, it's too late for our children. It is not too late for other North Carolina babies. Please pass the BUMP Act. North Carolina babies are worth fighting for. Thank you.
First, Anna, we are so sorry that you had to endure that. What I hate about this work is these poor moms have to relive that. Saw you had to take some pauses there, but you got through it. It is upcoming Mother's Day. So next we'll have Tamika Isaac, who also will be sharing her tragic story as well. Tamika.
Good afternoon. My name is Tamika James Isaac. I was born and raised in North Carolina, and I now live in Denver, North Carolina with my husband, Brandon. And I'm here to tell you something that no family should ever have to realize after the fact. It doesn't have to be this way. In 2017, I began what should have been a joyful journey preparing to welcome our son, Jace. Like so many mothers, I trusted the healthcare system to guide me, to educate me, and to keep me safe. But that is not what happened. On May 14, 2018, at nearly 36 weeks pregnant, after collapsing at home, I was rushed to the hospital. There, Brandon and I were told, without compassion, without preparation, that Jace would be born still. I was also diagnosed with HELLP syndrome, a life-threatening condition. I spent 45 days in the hospital and underwent multiple surgeries. I developed an infection so severe that I missed our son's funeral. No parent should endure that. No mother should come that close to losing her life. It did not have to be this way. When we began searching for answers, what we found was devastating. Basic routine care was missed. I was not given any urine testing during a high-risk pregnancy. I was not educated on warning signs. I was never told about something as simple as and as powerful as tracking Jace's movements. These are not complex interventions. These are not experimental solutions. These are standard, evidence-based practices. It did not have to be this way. This is why my husband and I founded Jace's Journey, to turn our pain into purpose and to make sure other families don't have to walk this path. Because stillbirth is not just losing a baby. It is also about the health and safety of mothers. Women who experience stillbirth face significantly higher risk of severe complications and even death. So when we talk about preventing stillbirth, we are talking about saving 2 lives at once. It did not have to be this way. We have tools like the Count the Kicks program that empowers parents to recognize changes in their baby's movements, often one of the earliest signs of something wrong. We have the data. We have the tools. We have communities ready to be educated and supported. What we need now is action. The BUMP Act is a prevention-focused solution that ensures every family in North Carolina receives clear, consistent, evidence-based education, and that every provider is equipped to respond. This is about awareness. This is about accountability. This is about equity. And most importantly, this is about lives, because it did not have to be this way. We have the knowledge. We have the tools. And today we have the opportunity. Let us choose to do better. Let us choose to act. Let us pass the BUMP Act. Thank you.
Thank you again to Mick, and oh my goodness, those little sneakers, and celebrates little Jace's birthday every year, so you post that. So again, Tamika, thank you for sharing your tragic story, and again, Preventable. Henderson Lanford is up next.
Hello, everyone. Thank you for having us here today. My name is Henderson LaFond. I'm a lifelong North Carolinian. My daughter Madison and her 3 brothers were all born here. The state is home, and its families are why I'm standing here today. On October 17th, 2015, at 34 weeks and 3 days, my world changed forever when we learned that Madison's heart had stopped beating. The night before, I noticed a change in the intensity of her movement. I did not know then what I know now, that a change in fetal movement is often the earliest and sometimes only warning sign that a baby is in distress. I believe that information could have saved her life. No family should lose a child to a preventable tragedy. No parent should look back and realize the information they needed existed, but it was never shared with them. When I learned about Count the Kicks, I knew immediately that this was where I wanted to give my time and my energy, in Madison's honor. I'm incredibly proud to serve as one of the Count the Kicks ambassadors here in North Carolina, because this work means that her story has the power to protect other families from the loss that my family carries. The BUMP Act ensures every expectant parent in North Carolina receives education on fetal movement monitoring. This is not a complicated ask. It is simply a matter of making sure that life-saving information reaches every family in every corner of our state. That is the heart of why we're here today, and it's the mission that drives our next speaker, Jen Raleigh, who is the Director of Advocacy and Engagement for Healthy Birthday, an organization behind Count the Kicks, a program that is already saving lives right here in North Carolina.
Thank you, Senator Murdock. Thank you, Henderson, Tamika, Anna, and so many other amazing moms that are here today. As Henderson said, my name is Jen Rowry, and I am the Director of Advocacy and Engagement for Healthy Birthday, Inc., the national nonprofit organization that created the Count the Kicks Stillbirth Prevention Program. Jace, Owen, Madison, they were all healthy babies that died unexpectedly. Their deaths have had a lifelong impact on the entire family, as you've heard. We can and we must do better for North Carolina families and healthcare professionals. By increasing education and awareness through Count the Kicks, we can prevent this tragedy from happening to more North Carolina families. That's why passing the BUMP Act is so important. As highlighted, today, there are proven evidence-based solutions to educate and empower both expectant parents and healthcare providers. By increasing awareness of critical warning signs like a change in a baby's movement, early action can be taken to help prevent the tragedy of stillbirth. In fact, research indicates that at least 1 in 4 stillbirths are preventable. Let that sink in. At least 1 in 4 stillbirths are preventable. And in states like Iowa, where Count the Kicks was implemented in partnership with the public health department there, the state experienced an overall rate reduction of 32%, saving 1 in 3 at-risk babies in its first 10 years. If we could replicate that success, which I know we can, we could save 231 babies here every single year. If that's not worth fighting for, I'm not sure what is. Making fetal movement monitoring easy and accessible for moms in North Carolina can and will improve birth outcomes, and we can save 2 lives at once. We're already seeing impact here in North Carolina, and I am so excited to share more about that. So far, 3 families have shared that because they learned about Count the Kicks, their babies are here today. These moms trusted their instincts, noticed changes in movement, and spoke up. It is my honor to welcome Emily Levin and her 4-year-old son, Henry, who is living proof of the powerful impact that stillbirth prevention efforts can have on families. Emily, Henry.
One of these, a little emotional. Hi, I'm Emily Levin, and this is my son Henry, and I'm a North Carolina mom. Shortly after finding out I was pregnant in May of 2021, I started doing my research and decided I wanted to try an unmedicated birth. I purchased the Mommy Labor Nurse birthing course at 26 weeks to help me prepare. My husband and I started watching the videos. We didn't get too far, but we got to the part where she recommended the importance of kick counting starting at 28 weeks. She recommended the Count the Kicks app, and I downloaded it. At my 28-week appointment, everything was normal. I remember walking into the exam room and telling the nurse I was ready to start my kick counts, but she looked at me and told me, "We don't start kick counts until 30 weeks. I went home that day and started my kick counts with the app anyway. I learned Henry's patterns, and I could usually get 10 movements within 20 minutes. When I was 29 weeks and 3 days pregnant, I noticed Henry wasn't moving as much, but his movements were still strong, and he was still reaching 10 movements, but it took longer than usual. The next day, I woke up at 6 a.m. to a faint kick and then fell back asleep. I officially started my day around 8 a.m., and about an hour later, I noticed Henry had not moved yet. I searched Google and started doing everything suggested to get him to move. I hesitated to call my OBGYN because I was afraid they would dismiss my concerns. By late afternoon, I had an overwhelmingly bad feeling and called my OBGYN. The nurse called me back a couple of minutes later, and I explained that I was 29 weeks and 4 days pregnant. I told them I had been tracking my baby's movements and couldn't get him to move no matter what I did. She told me I needed to get to the hospital immediately. The drive to the hospital was the longest 25 minutes of my life. As soon as I got there, they took me back and hooked me up to monitors, and I was relieved to find out that he had a heartbeat. Shortly after, it became clear that Henry was not doing well. A doctor told me he had lost all heart rate variability and his heart rate was dipping when I had mild contractions. They decided to do a biophysical profile, and he scored a 2 out of 8 with only his fluid levels being okay. After that, they told me Henry was in distress and they needed to get him out, and they prepped me for an urgent C-section. Henry was born at 11:15 p.m., weighing 2 pounds and 14 ounces. He let out one cry and was taken by the NICU team, where he stayed for the next 7.5 weeks. They were unable to ever determine what caused Henry to be in distress, but every time I shared my story, I was praised for knowing my baby's movements so well. I was told again and again that by tracking his movements, I saved his life. In hindsight, I should have called the doctor's office sooner, but I knew to call because I had been tracking him for almost 2 weeks. The response from the nurse at my provider's office during my 28-week appointment highlights the need for standard education and protocols for healthcare professionals to follow. The bumped app can help make this happen. Count the Kicks saved my son's life. It gave me the tools and data I needed to advocate for myself and for my baby. I don't want to imagine what could have happened if I had not started counting at 28 weeks like my childbirth course had recommended. Every mom, every family in North Carolina deserves to have the same information that I was lucky enough to find in my own research. Every provider also deserves to have the training and resources needed to improve outcomes for their patients. Henry is proof that prevention saves lives, but there are solutions to the stillbirth crisis in North Carolina. This is why we need the Bump Act to become law.
First, let's give a round of applause to these moms for sharing these heartbreaking stories. And little Henry is here as proof. We thank you for coming with Mom. And I'm sure he had to head to another meeting. You do have additional support in the House. Representative Zach Hawkins was just with us. We are working in the House and the Senate on this very, very closely. And you can hear the stories for yourself, which is why we wanted their moms to come here. One of the directors has come from Iowa, because if simply one life of a baby can be saved, and a mother, as Tamika shared with her story, she was knocking on death's door. It is God that kept her here. And so we know that through the Count the Kids program, more awareness, more education can really save lives. We've seen this with other issues, such as with sudden infant death syndrome. Those educational programs have saved a lot of lives. And I know we have WRAL here. I know oftentimes, I host press conferences and we say, we're going to hope to do something about this, and we're going to keep working. Luckily, this is one where these advocates are having meetings with legislators on today. Those meetings have gone phenomenally well. We are only asking in this bill for $250,000. These babies that you see here before you, definitely little Henry, is enough proof that $250,000 can go a long way to saving lives. I'm thrilled to report we are in the early stages of being confident that we will get funding from the Department of Health and Human Services through a grant. And after conversations today, we'll continue to work with the appropriation chairs on the House and the Senate side, but definitely with our healthcare chairs to make sure we can hopefully get additional funding this year. And we also would love to have recurring funding in 2027, 2028. We do know it will be a tight budget cycle, but $250,000 in the scope of a $32 billion budget is sofa change here in this building. So we know that we do agree with our colleagues on keeping mom and baby healthy and alive. We know that Count the Kicks is one way to do that. And so we ask everyone to advocate for the Bump Act, support its passage, and ask that it be fully funded at $250,000 during the short session. With that, we'll open it up for some questions.
What do those conversations with leadership look like? I know Democrats, it's kind of hard to move bills. Sometimes you have to have Republicans get involved. What does it look like?
This is one, and actually it's something I enjoy doing. You can put your bill out there, and as you know, even if the bill does not move forward, the funding can. So even if the bill stays in appropriations, where I believe it's been calendared, we had phenomenal conversations with some of the chairs today. Again, are very close to securing funding through Health and Human Services through a grant they already have, but that's only one-time funding. That is not recurring. To save the lives of mom and baby, we need to make sure that this is recurring funding that they'll get every 2 years. But conversations have been going very, very well, and the visuals help. We've talked about the bracelets, but here they are. So even if folks don't have, internet access through the actual bracelet, you can Count the Kicks, very low tech. And then these flyers provide more information about the actual app as well. And also education. I think definitely with Emily's story shows education is really, really key. And it's something in the healthcare space that may seem minor and trivial, but that culture change, there could be multi-generational myths that have been passed down of, oh, you didn't move a lot, when I had you, it's okay, it's normal. So the education is also to say, we have data to show you should in fact count the kicks, and it can literally save the life of the baby. So the educational component is also a part of that funding. And also thrilled to report, one of the chairs we talked to, he said, $250,000, that's it? So we will take that as a good sign that they will continue to work on this issue with us in the House and the Senate.